when we're physically active, our mental health is better, but also when we have good mental health, we're more likely to be physically active.
In 2016, exercise was identified
as a frontline monotherapy for mild to moderate cases of depression.
And the effects of exercise appears to be comparable to medication and therapy.
The problem is that we haven't really developed programs and supports to bridge people into services.
And that's part of the excitement of Mind in Motion program, where we've been able to develop a referral pathway in a very optimal kind of environment where mental health professionals can refer students to a dedicated exercise program that is tailored to their needs.
So Mind in Motion was initially designed and delivered in 2017.
As part of a collaboration between a School of Kinesiology, a Population Physical Activity Lab, BodyWorks, and Student Counseling Services.
So students who participate in Mind in Motion go through a 6-step process that starts with them seeking mental health care at counseling services.
So when a student meets with one of our wellness advisors or counselors, what they would be looking for is the severity of depression, their sort of comfort with exercise, as well as if they have, any other health conditions or mental health conditions that would really be contraindicated for exercise.
For those that think it would work,
they'll be referred directly to BodyWorks.
We provide 2 one-hour sessions in a week.
Students exercise for about 6 weeks.
And we encourage students to do 1 independent session on their own. We're targeting moderate intensity exercise. This is an intensity where your breathing changes, you might start to sweat, you are exerting yourself moderately hard, and we know that this is the intensity required to get the benefits of the exercise on our mental health.
Anecdotally, students are really actually excited that this is a resource that exists for them.
We know that a lot of students experience depressive symptoms, so having a program on campus that can meet the needs of students and offer them a treatment option is a really important part of person-centered care.
To be able to add this as an option that is on campus, is free, is accessible, and it has the research support behind it has been really, really valuable.
So students who participated in the program last year reported that they had improvements in their symptoms of anxiety, symptoms of depression.
The depression self-ratings and anxiety self-ratings by students are decreasing from baseline at the point where we're making the referral from our center to the program.
They also felt more confident exercising.
And so that's going to really translate into their relationships with peers.
And they seem like they're having lots of fun when they're in here.
It's also resulting in more productivity at school. And so this program is also really contributing to a well and a healthy student population.
I think one of the most important findings is that it's feasible. That perhaps many people may feel that someone with depression, maybe they would have more difficulties becoming more physically active and engaging in an exercise program.
So we had anticipated that there was going to be more absences than there were.
People with mental health problems such as depression or anxiety can exercise and can benefit from being more physically active.
And we were surprised that the participation rate was so high. Students were registering for sessions and they were regularly attending.
Okay, so I'd hope to see 2 things from Mind in Motion. The first is that it continues long-term on campus as a treatment option for students with depression.
And we know that exercise has so many health and wellness benefits in addition to antidepressant effects, that it's this really powerful treatment option for people.
And so I would hope that becoming aware of Mind in Motion as a treatment option, people can start to view exercise as a valid and effective treatment for symptoms of depression, particularly for mild to moderate cases. And the second thing is that we're hoping to integrate this into the kinesiology undergraduate courses.
We're going to be able to connect students with the opportunity to learn about mental health, mental illness, and what person-centered, responsive, ethical, and safe care looks like.
and that fourth year kin students will be leading the exercise sessions for Mind in Motion.
Ideally, over the long term, what we'd love to have happen is exercise offered as a standard treatment option to people experiencing depression.
So what we're trying to learn from this work with Mind in Motion is looking at what are the lessons that can be learned by setting up such a referral pathway. Can we apply the lessons in this perfect kind of scenario to the community?